never give up on a Black woman.
I ran the robots, one of the robots in front of the Supreme Court, but I was doing it remotely. I was doing it from my home here in New York. It's a robot that's about 3 feet tall, and it's on wheels, and it has a lid where it can expel pills
And
and says, "I want an abortion pill
that's all I have to say.
of mifepristone."
Oh, okay. Okay. The name really caught my eye. It
Yeah.
was the abortion robot. And I was like, oh, that's very clever.
Yeah. Well, it's Rebecca Gompertz has used the robots before. I think she used them in Mexico and maybe it was Poland, for demonstration purposes as part of a protest. And so this was just another opportunity to, take the robots on the road. And here, especially robots, as you mentioned, it was so appropriate. I'm not anonymous. There's no way. I've been in the Times and the Washington Post, and I was on PBS NewsHour last night.
Okay.
And NBC Nightly News.
Okay.
I'm one of the doctors who mails abortion pills into the restricted states.
Who is this woman? It's my pleasure today to be with Dr. Linda Prine, who is a family physician and activist, particularly when it comes to women's reproductive rights, and the co-founder of Miscarriage and Abortion Hotline. Welcome.
Thank you.
So let's start by just giving a little background about yourself, if you would. Where were you born? What school did you go to? And then, how did you get into all of this? Please share.
Well, I was born and grew up in Pittsburgh, Pennsylvania. I went to college in Madison, Wisconsin, at the University of Wisconsin. While I was there, this was pre-Roe, I got pregnant and had an abortion that I was able to get legally, but it was kind of a tough experience because it wasn't legal. And so you had to pretend that it was a risk to your life, and you had to go see psychiatrists and say that you were suicidal. And, it was a lot of hoops to jump through. And my boyfriend and I had to pay $500 for the abortion, which that's like charging $5,000 today. He ended up dropping out of school in order to keep on paying the bills for it. So that stayed with me, although I can't say it really traumatized me, but when abortion became legal, I thought that was a good thing. I ended up becoming a nurse after college and then ended up going to medical school. So once I became a doctor and I became a family doctor, I thought, well, I'm pro-choice. I should provide abortions. Like, it's within my scope of practice, so I should do this because I believe in it. And so I did. I worked at Planned Parenthood, and I didn't really like the model of care there. It felt very assembly line-like to me as compared to my general practice, where I really spent time with patients and talked to them. At Planned Parenthood, we just did the procedure. We walked in the room, we did the procedure. We walked in the next room, we did the procedure. And the patients sat in a room in their little Johnny coats waiting for their turn. It felt very dehumanizing to me. So I founded an organization that was meant to work on advocacy to integrate abortion care into primary care, especially because around that time, the abortion pill came on the market, and we started offering that in our family medicine practice. And it seemed like such a better model for personal care. And I worked in a community health center in New York City, where people did have access to abortion. They could go to Planned Parenthood, but I had patients who didn't want to cross a picket line, who felt very embarrassed about going to Planned Parenthood, and they really appreciated getting the care in person. And so that was something I worked on, trying to get other people to mainstream abortion care for about 20 years. through this organization I founded called the Reproductive Health Access Project. In 2019, I founded another organization. This was during the Trump years, and there was a listserv that I'd founded, that I was part of family doctors who discussed abortion care. And we were all very frustrated with the way things were going under Trump, with increasing restrictions in a number of states. And we wanted to respond. We couldn't quite figure out what to do. And I ended up having a conversation with Rebecca Gompertz from Aid Access. And she's a doctor from the Netherlands who mails abortion pills internationally to restricted countries, to people in restricted countries who need pills. And she had started mailing them in the US in 2017 when abortion access was getting more and more difficult. So she told me that they really needed a phone line, people who would answer questions from American women who were ingesting the pills. She couldn't handle the volume of discussions that Americans wanted to have. She mailed instructions and she mailed what to expect, but she only communicated with people by email. And there was too much volume at that point for her to be just constantly on her computer replying to people. So we decided this would be our radical action. We would make this hotline for people to call us who were self-managing abortions. We consulted with a lot of lawyers who told us it was a really bad idea, very risky. We would get in trouble, bad things would happen, but we did it anyway. There were about 12 of us who started it up. And we took turns being on call, and we would be on call for 12 hours a day. And we would each only need to be on call like twice a month. And it wasn't that busy in the beginning.
If I was having a miscarriage or if I was doing a self-managed abortion, I guess I'll ask you to explain what is a self-managed abortion. But if I was having that and I had a question, then I could reach out to you on this hotline.
Right, exactly. So it was all family doctors who had experience with medication abortion and miscarriage care who were volunteers on the hotline. And it got busier. And so we recruited more people and we divided it up into like 2 8-hour shifts. And it just kept getting busier, as you can imagine. Texas passed that SB 8 thing that made it really hard to get abortions in Texas. Aid Access was mailing more and more pills. And then Roe fell.
Yes.
And then we really got crazy busy. And we now have 3 6-hour shifts a day. We have 80 volunteers.
Wow.
We have, in addition to all the physician and nurse practitioner volunteers and midwife volunteers, we now have a logistics line that is lay people who volunteer just to answer non-medical questions, like where can I get pills? Where can I get funding? How does this website work? I'm having trouble with it. And the logistics people help folks who are trying to get abortion pills figure it all out. And now our phone number is given out not only by Aid Access, but by some of the Planned Parenthoods, by some of the other telemedicine abortion providers, and it's on the Plan C website. So that's a website that people use to find where they can order pills online, depending on what state you're from. So it has a drop-down menu by state, and people go to that website to find out where they can, what agencies will mail pills to them in the state where they live. Because abortion's illegal in so many states, there's only a few of us who will mail pills to the states where abortion's illegal. So the Plan C site has the miscarriage and abortion hotline number on it, as well as if you just Google, help with a miscarriage or help with an abortion, you'll eventually find us. So we get now, I would say, every time you're on for your 6 hours, you get about 20 phone calls and around 20 to 30 texts. And this is the texts will be back and forth. So this is, 20 or 30 individual people. So it is very busy. You cannot do anything else when you're on call now. And everybody loves doing this work because it's so needed. And we aren't really providing medical advice, we're providing medical information. We're not saying to people, you should do this or you should do that. Rarely do we do that. We mostly say, well, what you're telling me is you're 9 weeks pregnant and you've used the mifepristone and you've taken the misoprostol and you're wondering if you need to use another dose of misoprostol. Here's what we know. Using a second dose of misoprostol increases the success rate of using these pills. So, but if you're pretty sure you passed your pregnancy, you don't have to use more of the medicine. You can wait and see how it goes. Or if you want to just be on the safe side, you can go ahead and use more of the medicine. It's really your decision. That's the way we approach most of the conversations we have. We just give the information, efficacy's better, but it still works 95% of the time without another dose, or whatever the question is. We just try to give people the information and then they make a decision about what they want to do. And so that's kind of answers your question about a self-managed abortion. It's somebody who's ordered their pills online and doesn't have a resource other than the hotline, I guess, for how to talk to people, how to talk to a medical professional about the process they're going through. Every medication abortion is kind of a self-managed abortion.
And actually, that's exactly what I was going to say to you. What would be the difference between someone going to Planned Parenthood and getting the pills and then going home?
Exactly.
And taking the medication. That seems like a self-managed abortion.
I agree. Yeah. So the people, the researchers, I guess, are the ones who have made this distinction because they are always keeping track of how many people are getting their pills, what they call inside the formal medical system versus outside the formal medical system. And they consider aid access and the online pill providers outside the formal medical system. Even though we're doctors, we're mailing the pills, we're reviewing somebody's medical record before we send the pills. We're available by email during their process, but they call us outside the formal medical system. So whatever. They see the area code that people are calling from, but we don't ask people where they are. So we don't always know. I can say I speak to a lot of people who are calling me ma'am. So it's a lot of Southerners who are calling, and that's the most beleaguered part of our country right now when it comes to reproductive health access. It's a mess there.
And can you explain self-managed abortion in terms of medication? What medications a woman would take? Why would she take it? What's the purpose? And then we'll get into the whole controversy of the meds.
Well, it's the same medications you get from Planned Parenthood. It's mifepristone is the first medicine. That's a pill that causes a blockage of progesterone. It goes and sits on the progesterone receptors so that the pregnancy, which needs progesterone to maintain, is blockaded, and the pregnancy starts to separate from the uterine wall. The uterus gets a little softer, and it sort of readies the uterus for the next medicine, which is called misoprostol. And that medicine causes the uterus to contract and squeeze the pregnancy out. So those two medications work very well together. Neither of them work as well alone, although if you use enough misoprostol, if you use it over and over and over and over, you can sometimes get to close to the 98% efficacy, but it's a much longer process.
So both of the medications require a prescription from a doctor. Misoprostol is fairly easy to get. The other medication, mifepristone, is harder to obtain.
Yeah, it's the one that is under what's called the REMS, which is a FDA category for dangerous drugs. So it's a very restricted medication. And over the years, it was first approved in the year 2000. Over the years, there have been a number of reviews by the FDA of it, and they have loosened the requirements of the REMS, although they haven't removed them entirely. And that's what the Supreme Court case was about today, is that these pro-life folks are accusing the FDA of too much loosening of the requirements.
Now, the concern about the medication, is it because safety concerns, or are there other?
No, it's all politics. It's a very safe medicine. Has nothing to do with safety.
Are we sure about this, that there are no safety concerns with the medication?
It's safer than Tylenol.
Is it a concern because it will effectively terminate a pregnancy?
Yeah, well, that's what the right to life folks would say, is that it's an agent of murder, it's killing babies. That's their accusation. And I think that's why the FDA approved it with so much caution, not because it's risky for the woman who's ingesting it. It's not.
Because
It
it's
works.
just one pill that she takes one time
Yes.
initially, and then
Yeah.
she follows it up with the second medication.
Yes.
No one really has that many concerns about the second medication. Everything is focused on that one pill.
Yeah. I mean, yes, that's correct. Does it make sense? No, but it is correct.
So a woman that takes this medication, what is she likely to experience?
Well, what she experiences is just like a miscarriage, only it's been induced by the medication. So she experiences vaginal bleeding, cramping. Ibuprofen helps a whole lot with the experience because it blocks one of the chemicals that the misoprostol, the one that makes the uterus contract, it blocks one of the pathways of pain. So it makes the contractions not hurt so much. It takes about 6 to 8 hours to expel the pregnancy after taking the second medicine. And then there's cramping and bleeding on and off, not particularly severe, for about a week or two afterwards. And then another couple of weeks, and a person gets her period back, and life goes on.
So you're making it seem fairly simple. And if that's the case, why so many calls
Because
to?
there's thousands and thousands and thousands of women using these pills without a doctor anymore. We're Aid Access, the group I work for, we're
Yes.
mailing 10,000 pills a month.
Oh my.
Yeah. This is our workaround for all those women in those states that don't have abortion access.
And it's still legal to mail prescriptions to another state.
It's not still legal. It became legal because we advocated super hard for laws to be passed that are called shield laws that protect physicians in the state that has passed the shield law. They protect us from extradition, from having our malpractice taken away, from having our license taken away, from any disciplinary action by our state under, in the circumstances where we are mailing pills outside our state. We only have to comply with the laws of our state, not the laws of Texas or Mississippi or Alabama. So we comply, for me, with the laws of New York State, and then I can mail pills to all these other states. They can, of course, come after me, but New York State will not comply with any of their requests. They won't give away my medical records. They will not allow me to be extradited. They will not allow my assets to be seized. New York State will protect me.
That sounds
We
very
hope.
risky. That's that sounds very risky, and admirable on your part to do
Thank
something
you.
like this, because I can only imagine women don't know where to turn, and there are a lot of physicians who don't want to prescribe for the very fear that they'll get into some sort of legal trouble.
Yeah, yeah, exactly.
So if you were in a state that didn't have a shield law, you would be at risk.
Yeah, I can't even travel to a state without a shield law.
Wow.
Yeah, because I could be extradited from that
Mhm.
state.
Oh my.
Yeah,
And how many states have the shield law?
6.
Oh my.
We're trying to get more states. There are more states considering it. Rhode Island and Maine are considering passing shield laws. I don't know why Illinois hasn't done it yet, but they haven't. That would be great if they would. And Michigan, we'd like to see Michigan do it. But for now, it's California, Washington State, Colorado, Vermont, Massachusetts, and New York.
Wow.
Yeah.
Okay, so we know the question is really that first drug, mifepristone, and that there has been a lot of controversy about its prescription. And the issue is back in front of the Supreme Court today. Can you
Yes.
tell us what is the question being considered by the Supreme Court?
So this organization out of Texas is asking the Supreme Court to revoke the approval that the FDA, first they asked it to revoke it entirely, but the lower courts said this medicine's been approved since the year 2000. There's, way too much documentation of its safety to take it back that far. But we will ask the courts to consider the 2016 and the 2021 updates that loosened some of the restrictions. The loosened restrictions allowed nurse practitioners to provide the medication. They approved it up to 10 weeks instead of only to 7 weeks. And they allowed in 2021, during the pandemic, they started allowing it to be distributed by mail.
Mm-hmm.
Now, they had to be presented with evidence that all of those situations were safe. And they were presented with evidence that the pills could be swallowed and it was just as effective swallowed at home as swallowed in the doctor's office, right? Lo and behold. And we literally did studies to show that. I was part of my family health center was one of the sites for some of these studies. We had a randomized controlled trial where we sent some people home with the pills and had some people swallow them in our office, and we tracked the outcomes.
And in terms of complications, side effects, did you see a difference between
No,
those that swallowed
but
it in the office versus those that swallowed it at home?
no. Now, they tried to argue today at the Supreme Court that women who use the pills at home use the emergency room more than people who got the pills in the doctor's office. There were some studies that showed that that was true and some studies that showed that that wasn't true. But the FDA also looked at what was the complication rate. Just because people go to the ER doesn't mean something worse has happened to them. So they looked beyond just the use of the ER to whether or not they got admitted to the hospital, whether or not they got a blood transfusion, whether or not they got a surgical procedure. And they didn't find a higher complication rate at all. So it was just that people, in some of the studies, more people went to the ER if they had not seen a doctor to get their pills to begin with. And it was still tiny. It's a tiny amount of people that go to the emergency room. It's not a lot.
And that's
But
consistent with the fact
the
that if you're not having any interaction with a health professional and you have the pills, and this is maybe your first time, you have questions. And so, again, this is where your organization, M&A, actually fills that need of, I don't
yeah,
know what to expect. Can you help me?
especially now, because people are afraid to go to the emergency room in these states, right? They're afraid of prosecution. They're afraid somebody's going to figure out that they got these pills from somewhere. And it's not illegal. I mean, let me be clear. It is not illegal to order pills online. The laws that have been passed make it illegal to prescribe the pills to patients in the state of Texas, but it's
Is
not
it
illegal for a
safe?
Texan woman to order the pills and take them.
Is it safe to order pills online? If
Yeah.
if I'm considering a self-managed abortion, meaning I'm going to do it at home, and I go online,
Yeah. So the Plan C website has vetted all of the agencies to make sure that the pills that they are sending are real medicine. They that they have in them what they say they have in them and not anything else. So if you find
that's
your
an important point. I mean,
yes,
if I'm going online, I'm doing this for whatever reason. I need to know that the medication I'm receiving is the medication I should receive.
yeah,
This is
yeah,
a reputable source.
exactly.
That's good to
So
know.
so people go to the Plan C Pills website, say they're from Louisiana. They look at the drop-down menu. There's two organizations they can order pills from that provide the FDA approved pills from a licensed physician.
What is it expensive?
So one organization charges $250 and the other charges $150. And both of them will negotiate a lower rate if people can't afford what they're offering. So about at 8 Access, about 1/4 to 1/3 of our patients pay much less.
Okay. And the medication is prescribed by a doctor currently?
Yes.
Does the doctor have any interaction with the person that's calling for the medication?
So they fill out a whole medical history form that we then review and make sure that everything's okay before we send the pills.
I
We
see.
find, how far along is the pregnancy? Have they had prior pregnancies? Have they had C-sections? Are they on any medications? Do they have any medical conditions? All of that information has been gathered before we send the pills. When we send the pills, we send them an email with directions, and we send directions in the package of how to take the pills. And we send the phone number of the M&A hotline, and they can write back to us at the same, through the same website portal that they've been using to order the pills.
Are there situations when you don't prescribe the medication, and what happens at that point?
So we only prescribe it up to 12 weeks, 6 days of gestation. So if somebody's 13 weeks or beyond, we refer them elsewhere.
Do you
There,
require an ultrasound, or how do you know that?
no, and the FDA has never said that an ultrasound is required.
Okay.
That's never been part of the REMS.
Okay. So this is
So,
based on last menstrual period.
yes, and women are very good, and there have been studies to show that people know when their last menstrual period was.
Yeah. Hard to ignore.
Yeah, I mean, a lot of this is about trusting women, really.
Mm.
You know, knowing that people are making the decision that they want to make, that they're giving us accurate information, and we're giving them what they need because they've asked us for it.
Mhm.
It is a trusting relationship, I feel like, between the clinicians who are providing the pills and the people who are getting them. And we get such wonderful messages back from the folks that we take care of. I mean, they are so lovely and grateful for the help because when you live somewhere like Southern Louisiana, where are you going to travel to? Florida? Like it's
Yes,
hundreds of miles.
yes,
Kansas,
yes.
Illinois, where are you going to go?
The other irony of all of this is this has been done in other countries for years now. And it's not as though we're on the cutting edge. We're
Right.
way back. We're
We're
back.
only on the cutting edge of restricting women's access. That's what we're on the cutting edge of.
I think the World Health Organization has already said yes to this, to self-managed abortion. They've
Yeah.
already said is as good as being in the formal healthcare system and having a termination of a pregnancy. So we're not doing anything that hasn't already been done and shown to be safe.
Yes, that's right. The Supreme Court may undo this. Before them is the question of whether the pills can continue to be mailed. And that's what the debate was about today. And they have it in their power to say we're going to roll back this FDA approval to 2016 and no longer allow the pills to be mailed. And that would effectively strip 14 to 16 states of any access within the state.
And it disproportionately affects people who cannot travel, who have limited income, women of color, disadvantaged groups will be greatly impacted if that's not an option for them.
Exactly. Exactly.
And the fallacy is that it won't stop self-managed abortions.
Yeah.
It may,
Yeah.
in fact, make them riskier, but it's not going to actually impact. If a woman decides she's not going to have a pregnancy, she's not.
Yeah. Yeah. So that's the danger.
That is the danger. Wow. Remarkable work that you're doing.
We heard that they're coming after us as soon as the election's over. So stay tuned. You'll have to make an announcement for my bail fund. No,
I mean, seriously, do you have any physical, have you been threatened physically? Do you have any
no,
concerns about that?
no, I don't. I mean, I think that they will come after us, but they'll try to sue us. They'll try to have us arrested. They'll try to, you know, take away our livelihoods or whatever. I'm sure they'll try all of the above, but I'm counting on New York State to have my back.
I'm sure. And I was able to go to the hotline. It's a great website, M&A, Miscarriage and Abortion Hotline.org.
Yes.
Yeah, very informative. I think easy to understand. I think anyone who goes to the website will be able to manipulate and maneuver through and find the information that they're looking for. But that website, your site, does not give any medications, correct?
Correct. We're just a
Information,
site for information. Exactly.
right? But you have the information to those sites that are able to
Yeah.
provide medication.
Yeah. And that's what our logistics volunteers do is they tell people about the other websites, which ones have information in Spanish, which ones, you know, what the costs are, the various websites, whatever the questions are, the
Right.
logistics folks help out with that.
So if I'm considering doing a self-managed abortion, I can go to the site. If I've already started the process and I have questions, I can go to the site with
Yeah.
any quote
And
unquote
you can
complication.
and you can call or text. We do both. And I mean, really the common questions are, am I bleeding too much
Mm,
or am I bleeding enough? Should I
mm,
be bleeding more? Is it
mm,
really working?
mhm.
Or
That's right. I mean, that's the question. If I've done this, how do I know that it's worked?
yeah,
And
that's
so,
that's a really common question. And the answer is, I would ask you, how are your pregnancy symptoms? Do you still feel nauseous? Do you still feel tired? Do you still have breast tenderness, or are those things going away? And 99% of the time, people say, oh, yeah, you're right. All of those feelings are going away, and I feel back to myself. And that's the main indicator. That's a very reliable indicator that the pills have worked.
I could see why people would go to the emergency room for confirmation, not
Yeah,
necessarily because they have a problem, but for
exactly.
confirmation. So, do you advise them to take a pregnancy test?
The problem is the pregnancy test stays positive for 4 to 6 weeks after using the pills. So that's another common call we get. My pregnancy test is still positive. What should I do? And it's usually that it's supposed to be still positive because it's only been a couple of weeks. So, we talk them down off the ledge
Absolutely.
and,
Absolutely.
explain this is normal, ask them about their symptoms. Their symptoms are all gone. They feel back to normal. They had the required cramping and bleeding, and they're okay.
Yeah. 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 That's the only problem in this wonderful system because after doing something like that, you want to know that it worked.
Yeah.
And actually going to the emergency room, and you know what they'll do? They'll do a pregnancy test and it'll be positive. And if you're bleeding, you might end up with an ultrasound, but the ultrasound will then say there's nothing in the uterus. And yeah, you spent lots of hours in the ER, but you go away feeling like it worked.
Yeah. But
Oh,
see, that's what these people are accusing
yeah,
the FDA of neglecting. They're saying, well, all these visits to the emergency room are a reason why the pill should be handed out in the doctor's office.
yeah. That's an interesting. I see a need for some way to affirm that you're okay, that it worked after doing this. And there
Yeah.
isn't. And you're just like you said, am I bleeding too much? Am I not bleeding enough? How do I know? And we basically say, just wait it out, which is really the best answer.
Yeah.
But
I mean, we do put that information in our instructions.
yeah,
It's just a lot of instructions, it's how to take the pills,
yeah,
when to work, what are the signs that something might be wrong? How do you know when you're done? I mean, it's like pages of, how do you take the pills if you're under 8 weeks? How do you take the pills if you're 8 to 11 weeks? How do you take the pills if you're over 12 weeks? It's a lot of pages of instruction. And people sometimes don't get to that part at
absolutely,
the end that says, how do
absolutely,
I know when I'm finished?
absolutely. Because it's a traumatic, it's a situation that's very
Yeah.
emotional.
Yeah, yeah. Which is why it's great when they call the hotline because we really
Absolutely,
talk to them about it and
absolutely.
we help them process the whole thing. Honestly, it's not like we just say, "Oh, you're good." We listen, they tell us everything, how many pads they were soaking through, when they took the pills, whether they ate or they didn't eat, the whole thing, who was their helper, does their mother know or not? Like we really have a conversation and listen to what they've experienced and then reassure them. And a lot of times we talk about the whole politics of it. Sometimes we
Yes,
talk about the morality of it. Sometimes we
yes.
talk about the people will say, I had to do this because blah blah blah. They need to
To
hear,
justify, yeah,
yeah.
yeah, yeah,
Oh, it's I mean, I think that it's a really important process for people to have that opportunity to go through with somebody who they basically do come to trust us because we have such good conversations and they know they're talking to medical professionals and we're we're mostly just listening.
right, right. And it seems to me if we were really committed to women's health, we would have multiple organizations such as yourself available to women that they could access locally, where they could get their questions because you want reassurance and confirmation after doing something like this.
Yeah.
And yeah,
I think some of the abortion funds have evolved into that being that kind of a community group in some areas of the country. I think there's a group called Yellowhammer Fund in Alabama that I think people turn to because they know them. They've been their abortion fund for many years, and they turn to them in, when they're going through this process, and those folks know how to talk somebody through everything. But some of the groups are afraid. They're afraid that they'll get somehow legally implicated, and so they don't want to be involved. So there's a range of what the community groups are doing.
That's an interesting point. A woman taking this medication, can she be arrested?
No,
Is it
because
illegal?
it's not illegal for her to take the medicine. It's not illegal for her to order the medicine. It's only illegal in one state for her to travel to get the medicine. That's Idaho, and that's just minors. Minors are not allowed to travel outside the state of Idaho to get the medicine. So really,
So there's no legal consequence outside of that one scenario for a
there shouldn't
person.
be. I mean, I'm not saying that police never overstep their bounds, and there are some overly zealous people who work in emergency rooms that don't know the law. And if they think that somebody has ingested abortion pills, there's been like a couple of cases where people have been reported. Only one case that I know of where someone's been arrested.
Oh.
But it's, there's a lot of those kinds of cases get a lot of publicity, and then it makes people afraid.
So we're talking about doctors or nurse practitioners that might
No,
tell the police.
it's usually a medical assistant or an emergency room nurse. It's not the treating physicians. I think for the most part, treating physicians know that they're not obligated to be reporters. We get so much training in what we do and don't have to report, and there is no reporting requirement for using abortion pills at all. But and this is actually from the data on people being reported for their abortions it goes back before the fall of Roe, that people have been reported if they used drugs while they were pregnant. They've been reported if they got involved in a domestic violence situation where they got hit in the belly and could have harmed their fetus while pregnant. So there are people out there that take it in their own hands to report pregnant women. Disproportionately, women of color get reported. And now there's a fear that people using abortion pills will be reported. It hasn't come to pass that we know of that there's increased reporting since abortion became illegal, and there's no laws to do anything about somebody who uses pills. But there's a lot of fear out there.
There is, and there's a lot of misconception about even if you assist someone in terminating a pregnancy, that puts you at risk.
Yeah, well, there are aiding and abetting laws. So that's what people are worried about. There were, I think Texas is the main state that has the aiding and abetting law.
Right.
So people are worried about that, although there was only one doctor who was ever charged with doing an abortion after, and I think it was after SB8. I don't even think it was after Roe. It was just after SB8, and those charges were dropped and nothing ever happened.
But it's the fear of it. It's the fear of it.
Yeah.
And it's the reason why you can't go to Texas.
Yeah. Yeah. Well, because Texas does think what I'm doing is illegal. They don't think that the women I sent pills to are breaking the law, but they do think I'm breaking the law. And I am breaking their law. I'm just not breaking New York's law. And I'm licensed in New York, so I follow the laws of my state. The Supreme Court is the one that decided this was going to be a state-by-state thing. So this is what they get. This is what they get when they're going to do a state-by-state thing. Texas is going to make it illegal. New York's going to say doctors can prescribe to all 50 states.
And that's a great point. With Roe versus Wade, the decision was nationwide abortions are okay up to this number of weeks gestation. With what happened in June of 2022, it was no longer determined at the federal level. It was now being determined at the state level. And now we have all of this craziness. One state says yes, another state says no.
Yeah.
Yeah. Not a total disservice to women. Total disservice.
Yeah. Yeah. I mean, we need to do something about it. And some of the things that are being done now in some states, they are passing, they're having voting on whether or not it's going to be legal in their state. And every time it's put up to the voters say it should be legal. So some states are enshrining the legality of abortion for all time to come. Michigan's done that. New York's done that. And Ohio did it, although their legislators are trying to undo it, but they voted for it. And votes are coming up in Florida and Missouri. And there's 4 states that have ballot initiatives where they're going to vote on the legality of abortion for their state. So if all these states make it legal, that will be great. That helps. But we still have some of these very beleaguered states. It's going to be hard to vote out all the horrible people that are in the legislatures in Texas and Louisiana.
Something like 14 states, I think, that have banned abortions at this point.
Yeah.
Oh my, it's a mess.
Yeah.
I just have to say thank you for the work that you're doing.
Thank you for having me talk about it. We need to spread the word so that everybody knows.
We do. Is there anything that, I mean, all of us can't be on a hotline. Is there anything that we all need to vote?
Yes.
Is there anything that women can do? Because I think the answer is going to be with women kind of taking an initiative about their own reproductive rights.
Yeah.
Do you have any suggestions or anything women should do or think about?
I think the word of mouth is incredible. So many of the patients that I send pills to, when we do ask them to fill out an evaluation at the end, and we ask them how they heard about it, they heard about it from a friend.
Mm.
So the word of mouth is super important. So spreading the word, tell your family, tell your friends. If you know anybody who might have a pregnancy that they don't want to continue, they should know about this resource. Here's, either Plan C pills or aid access or the M&A hotline, all of those,
One last question. Some women are being proactive. They're ordering medications to have at home just in case.
Right.
What are your thoughts about that?
Oh, yeah, I send them all the time. I think that's brilliant. Yeah, that's good thinking, because who knows?
Right.
And people are ordering it for their daughters for just in case, or their granddaughters. Like, people are having them in their medicine cabinet for their neighbors or whoever. It's a community effort here to preserve access, because you just never know when you're going to hear from somebody who is desperate and they don't know where to go, and you've got the solution in your medicine cabinet for them.
Bottom line is self-managed abortions are doable and they're safe.
Yeah. And there are resources.
And there are resources and places you can go to. Thank you so much. I really appreciate the conversation. Take care.
It was great talking to you. Okay.
Bye.